Hi, my name is Michele Rothbauer, and I'm a certified exercise physiologist. And today I will be discussing the importance of exercise. So, why should I exercise? Exercise, there are many reasons to exercise, and I'm just going to go over a few, but it is important to exercise to help build and maintain strength, to maintain the flexibility of your bones and joints, to build stamina and be able to increase the amount of exercise and activity that you can do. And it helps decrease any shortness of breath that you might have. And also it helps increase mental performance. Exercise also helps increase the ability to perform your daily activities. And what are daily activities? Daily activities of living are like what you do every day, like bathing, dental hygiene, toileting, eating and dressing, transferring in and out of the car, walking around your house, stuff like that, stuff that you do every day. Exercise also helps decrease aches and pains. And it also helps to maintain an independent lifestyle so you don't have to depend on others to help you get around or get dressed or get in and out of the car. Exercise also helps decrease any stress level that you might have and helps increase your energy. Exercise also helps decrease or maintain the appropriate body weight. And it also helps decrease the effects of osteoporosis. Now on the slide, it shows normal thinning and osteoporotic bone. So normal, you see there's more dense. The bone structure is more dense. Thinning, it gets a little less. And then osteoporotic gets very dense or gets very weak. Exercise also helps to prevent or control diabetes. People that are diabetic, when they exercise, their blood sugar levels stabilize or even go down with exercise. Exercise also helps decrease blood pressure. The slide shows healthy blood pressure for healthy hearts. So blood pressure like 130/80 can cause serious health problems, or the higher your blood pressure is, the more health problems that you might have. So like heart disease, stroke, kidney disease, dementia. The slide mentions to have your blood pressure checked at least once a year. It's actually better to have your blood pressure checked more often, even once a month if you can. You can go to the grocery store, get it checked there. Anywhere that has a blood pressure machine, just make sure you're sitting for at least 5 minutes before you take a blood pressure. And then also make sure your arm is held at heart level to get a appropriate blood pressure reading. Exercise also helps decrease cholesterol level. In the slide, it shows HDL, which is good cholesterol, and LDL, which is bad cholesterol. In the slide, or in the picture to the left, the low, shows about an even amount of high and HDLs and LDLs. In the normal, you have a little bit more bad cholesterol, that is normal. And when you have high cholesterol, you have way more bad cholesterol than you do good cholesterol. So you just want to keep that down. Exercise also helps decrease any chance of heart attack or stroke. So how do you get started? First, you want to consult your physician and make sure your heart rate and your blood pressure are good. You also want to recognize your limitations. So if you have any joint problems in your knees, in your back, your hips, your shoulders, you just want to recognize those. And also make sure you listen to your body. If the exercise is too hard, then back off, slow down, or just don't do it. Just listen to your body. It's always a good idea to wear good, comfortable, supportive shoes and loose, comfortable clothing. You want to exercise in a well-ventilated and unconfined environment. And it's always good to exercise with others. Exercising with others, not only for motivation, but also for safety. Guidelines to follow as you start to exercise. You always want to start off slowly, and then you can progress. Try to be consistent. The more often you do it, the easier it's going to be. You'll be able to work out longer, harder, just be more consistent. Break up your sessions if needed. If you can only do 5 minutes in the morning, 5 minutes at night, that's fine. Work up from there. If you can only do 10 minutes and 10, break them up. Otherwise, you can do 20 at a time, whatever fits your schedule and whatever you're able to do, as long as you keep moving. So maximum benefits. This slide talks about maximum heart rate and target heart rate. To raise your heart rate to 60 to 80% of its maximum for up to 20 to 30 minutes most days of the week is recommended. So to find your maximum heart rate, you take 220 minus your age, and that's the number, and then you take that number times 0.6 or 0.8. 0.6 is like a less hard work. So like 0.8 is greater intensity. So an example would be if your age was 50, you take 220 minus 50, you get 170. That's your max heart rate. And then you want to multiply that by 0.6 to get like 102, which is your target heart rate, which is less intensity, or 0.8, more intensity. And you can have a range there of a heart rate that you want to try to stay within. So what kind of exercise is best for you? So exercise, an exercise program can include coordination, balance, flexibility, stretching, strengthening, and any heart or lung exercise, also known as aerobic exercise. How does it work? So frequency, you want to try for most days of the week. Intensity, like we talked about in that other slide, it's 60 to 80% of your maximum heart rate. And time, a good time to work up to is 20 to 30 minutes. And if you can't do that, that's fine. Start off slowly. If you can only do 10 minutes, that's perfectly fine. But a good goal is 20 to 30 minutes. And then the type of activity should be anything that you enjoy. If you don't enjoy it, you won't do it. So try to do an exercise or an activity that you enjoy. Like walking is the most readily available. You just get out and start walking, and try to vary the intensity. So you can walk for at a normal pace for a while or a couple minutes, then go to a higher intensity pace. So just vary your workout. And always, of course, stay active. Your body will thank you for it. Thank you, everyone.